I'm delighted to be joined now by Darren Breen from iMEDicare, a company specialising in pelvic health devices. Darren, welcome. Many thanks for joining us here today. We often associate incontinence with women who've had children or the elderly, but it's really prevalent among men of all ages, isn't it?
Absolutely. In fact, incontinence, urinary incontinence, will affect 10% of all men across the spectrum of ages. This rises with age. 30% of men over the age of 40 suffer from incontinence, and the prevalence increases enormously in the geriatric population.
And what sort of impact does it have on people?
Well, apart from the obvious incontinence dermatitis, men are very concerned about leaking in public, the risk of a stain, a visible stain on their clothing, or odor, and it leads to anxiety, of course, and then possible social withdrawal, and that can even cause depression in severe cases.
And what sort of techniques are available? What sort of things are available to help people manage their condition?
The NHS strongly support the use of adult nappies, mainly because they're very effective, and condom catheters. So both of these solutions can work extremely well, but they do have limitations. So, for example, we hear from our male patients frequently that they're frightened to travel significantly because of the fear of pad saturation. So they plan their day by the location of a toilet, and that can restrict what they do.
You have a number of options at iMEDicare to help people manage the condition, don't you? Talk us through some of those.
Absolutely. So our philosophy is what we call mix and match, the idea that no one solution is perfect in every social situation. So we have a range of options that give men a lot more flexibility and freedom and confidence to do things. So, for example, we have washable incontinence underwear that literally just has a pad built inside. So it comes in lots of different colors and styles and sizes, and you just wash and reuse. For important business meetings or weddings or scenarios where they don't want to take any risk of leakage whatsoever, they can use a urethral control device called Pacey Cuff as a quick fix. It literally just stops the urine escaping completely in a safe way. And if the leakage is very severe, they can use a urinal device called Afex. This is basically a portable toilet. The penis drops into the receptacle, the urine flows through into a collection bag, and they can empty it when they get the opportunity. So they can then have the confidence and freedom to travel. If the incontinence is very severe and they're retracted so that a condom catheter may not work, the Men's Liberty paddle sheath will glue to the tip of the penis, and very effective.
Environmental considerations are huge, of course, and sustainability. What sort of emphasis do you put on that? You alluded to some of them there.
Well, the important point for us is to minimize the impact on the environment, and the mantra is reduce, reuse, and recycle. So all of these devices can be washed and reused. They're made from renewable materials, much better for the environment.
And how does iMEDicare work with Bladder Health UK to really help people manage their conditions and to support them?
It's a fantastic charity. They're raising the awareness for incontinence issues in the UK enormously, which is helping millions of people. So we decided we would try to raise some funds to support them. So later this year, myself and some executives from iMEDicare are doing what we call the 4-Peak Challenge. We're climbing the 4 tallest mountains in Britain over 4 days via the Ridge Route. It's going to be tough, but we hope we can raise some funds.
Well, good luck with that.
Thank you very much.
Many thanks for joining us. Thank you.
Pleasure.